Welcome to this virtual forum lightning talk. And I'm really excited because we have heard this theme of working with community and faith leaders throughout all of the presentations over the past few days. So my name is Anna McCartney Melstead. This lightning talk is about working with community and faith leaders. And I'm really excited because I work with Breakthrough Action, and we've been doing some work with community and faith leaders as well as many of you on this call. So today I'm joined by our expert Zoom support person, Emmy Abihara. And as before, the slides are in English, French, and Portuguese, and they're available on the links on the slide as I've just shared. Emmy will be sharing her screen with the lightning slides in the language of the speaker. So don't forget to put your language specific interpretation at the bottom. You can see the little world, make sure you have your language so you can understand the presentation. And speakers, this is especially important for you. You must choose your language so the recording can capture your audio. So we have three presentations today. The first is from Bishop Matsolo, and we'll hear from him about working with religious leaders in rural areas of Mozambique. Then we have our next speaker is João Lino Rafael, and he works with Flame. And then we'll hear from Zimbabwe. Cynthia will tell us about the community action cycle. So the agenda is very full today. I have a timer and I'm going to stick with it. So speakers, you have 5 minutes to present your slide, and then we'll have about 3 minutes for questions and answers. So please stick to your time. I know especially sometimes we get really excited, but we really need to stick to our time limit. Please put your questions as usual in the chat. And with that, let's get started. So Bishop Denis Matsolo is from the Interreligious Platform for Health Communication called PureCom in Mozambique. Please go ahead and present for us, Bishop Matsolo. Next slide, please.
Thank you very much. Good evening, good afternoon to everyone. I am here to present the social behavior communication change intervention community approach to religious leaders in Mozambique. For us, this is a hope that we can rejoice with when we recognize that we can come together, different stakeholders fighting against malaria. And here is our contribution as religious leaders. We mobilize religious leaders who should work closely with community leaders to reach the target group. Integrate a family model role into PureCom implementation strategies. And according to MIS 2018, people with low education and poverty situation are more vulnerable in terms of lack of information and access to malaria preventive methods. For that, it's important to explore the communication channels, such as community events and community radios, to reach those targeted groups and people and link with health facilities. In community-based social behavior activities, the issue of gender is very crucial. Special messages could be strategically included while developing and disseminating malaria or other public health related messages. Background, malaria is considered among the most high affecting public health problems in Mozambique, accounting for 25% of all death, followed by HIV and AIDS, which is 27%. This suggests that there is a need to intensify efforts, including SBC, in order to drive a reduction in malaria mortality and mobility. religious leaders are trusted messengers that have proven effective in sharing messages on malaria, social behavior, and communication change. So the methodology, the method that we use is a socio-ecological model, where qualitative and descriptive studies that are carried on, focal group discussion with beneficiaries, in-depth interviews with key stakeholders, health authorities, implementing partners, and community leaders. And secondary sources, including PIRCOM records, reporting documents, and other useful technical references. CAP, the quantitative studies, is also something that we take into consideration. So in terms of results, PIRCOM used 3 approaches to reach communities with malaria prevention and treatment messages. And these are messages that lead to action. Sermons and community meetings by religious leaders, home visits by volunteers, and the dissemination of malaria messages with community radios. 528 religious leaders were trained, 130,630 community members were reached through sermons, and 237,474 were reached by home visits and through community radios. 689 malaria programs were broadcast, and these reached 3 million over people. Promote the dissemination of malaria messages or other public health messages via PIRCOM leadership and PIRCOM religious leaders. PIRCOM has the capacity to reach out to broader communities through its extensive network of religious leaders who are influential in disseminating information and promoting effective practices. Another aspect related to the behavior communication change is the consistency of the reception of the messages. Those going to church, mosques, must most of the time have consistent participation in the communication events, thus allowing for a build-up approach. And so we think there is an element of an added value that can be brought by religious communities in the intervention. So we are here making our contribution as religious leaders and trying to bring our really and interesting approach by also aligning the messages of health with the sacred scriptures, as to show that actually what the technical team from health and even the government say is something that even God has said long time ago. We can point out to a verse in the Bible, a verse in Quran, and that actually reinforces the messages that we're trying to transmit. So this is what I wanted to share in a nutshell, considering our time. Thank you very much.
Wow, thank you, Bishop Matsolo. What a great presentation, and how exciting. The reach from your intervention was so massive. Can you tell me a little bit, or us, a little bit more about this family model role? It says at the top, it talks about integrating the family model role into the PIRCOM implementation strategy. What do you mean by family model role?
We're talking about the involvement of the family. So there is engagement with the families. And interesting enough is that our volunteers and even the religious leaders that are involved in the process are trained in order to come not as having answers for the issue, but trying to learn also from the families, from the community. So indigenous knowledge is very much emphasized here. We need to learn from what has been the practice, how the people have been fighting malaria, how have they been trying to repel mosquitoes, for instance, and then we will discover that even certain repelling plants have been discovered at the level of communities, and those things can be shared from one community to another. That is what we mean.
So interesting. Thank you so much. We have a few questions here that follow the same logic, and it's about motivation for religious leaders. How have you been able to keep the religious leaders motivated and interested? Our colleague Tope says we struggle in our program to keep them interested without financial incentives. Do you have any advice?
Yeah, in working with religious leaders, one of the things that comes to mind is the fact it's a commitment of religious leaders. It is not money-centered approach, you know, it's people-centered approach. Of course, we need resources to facilitate the mobility of the religious leaders. We need means of transport and movement from one place to another. But that will not stop them from doing their contribution, at least at the place where they are localized. And so it is indeed very important that we create bases and offer all the necessary support to encourage the religious leaders to move on and make their contribution. And that is so crucial because we are working in a context where there are many other organizations doing the same work, and some will even give some subsidies that we are not able to give, and that takes us into an unloyal competition, you know, and then that is not helpful to what we're trying to do, and we're trying to convince our countries and our religious leaders to take as a consideration. But we continue to mobilize to say we have got a role to play, and therefore we have to do our part, even if we are not with the availability of funds as such. But in fact, subsidies for transport in particular are very crucial because that will facilitate the work that they are doing.
Yeah, I think that makes a lot of sense, Bishop. Thank you so much. In the interest of time, we're going to move on, but thank you so much for the presentation. And if others have questions for Bishop Masolo, please type them in the chat and he can respond in your written response. So our next presentation is from Joao Lino Rafael from the Faith Leader Advocacy for Malaria Elimination, FLAME organization in Angola. So he will be speaking in Portuguese, so please make sure to have your interpretation set to English at the bottom of your screen. The floor is yours, Joao Lino Rafael. Thank you so much.
Muito obrigado, boa tarde a todos.
Thank you very much. Good afternoon, everyone. Before I start, it is important to describe FLAME, which means Faith Leader Advocacy for Malaria Elimination. In Portuguese, we try to translate it as advocacia. Well, so to say that FLAME is present in the countries in Zambia and Angola since 2020 and Namibia since 2021. Since the beginning, the Flame, more than 1,400 religious leaders were a part of it that were trained regarding the basic advocacy principles and also when it comes to communication of SBC in malaria. It also exists more than dozens of. So for advocacy, it is the center of attention of Flame. But doing communication when it comes to SBC, it makes religious leaders very effective as advocates for our population. At the end of every sermon, a lot of Flame leaders who have at least 5 minutes to talk about prevention and community and family, very interactive sessions in the routine in conveying their words. But advocacy with people who are powerful in the society changes the reality in more depth. For instance, in Angola, Flame uses to influence the state and the private sector with a capacity to fully roll out the good policies that exist and increase access to services of health with quality, including malaria, and especially in the people who live in the periphery that traditionally have difficult access to roads and pathways and information. So these people are very much assisted by Flame. In the photo you see, we can see the bishop. This is a bishop of one of the provinces of Rwanda, and this was in a conference carried out in June, where the Minister of State and Parliament, ambassadors, representatives of organizations that were working in malaria, leaders of different religious denominations, and other people that are influent. He was encouraging the leadership to invest in the distribution of nets for the entire country, not only in the provinces. So we brought here some results. How does the advocacy strengthen this approach when it comes to SBC and vice versa? We know that communication, when it comes to SBC, it becomes more effective due to work and synergy with other initiatives and strategies. And a concrete case of advocacy, it also reduces the barriers, the existing barriers, and focuses on strategies so that the tools are available to be completely adapted for the public in general, for the general audience. That's very positive and produces a lot of effective results. Now we're going to translate these results into good examples. An example of that.
Nesse preciso momento está a decorrer a distribuição universal de mosquiteiros na província do Kwanza Sul, uma das províncias do Flem, que faz parte também das províncias contemporâneas.
Which is also part of the
A
provinces
distribuição
with the
de
nets.
mosquiteiros através the religious leaders receive a complaint about certain areas that were registered, but they didn't have received the nets. Other situations occurred about the nets that were freely distributed. They were being sold. So we talked to a priest that told us about the situation, about these situations, and also the national coordination went to the situation where all those things were happening with the local administration, and they figured out how to do it and took care of the situation. Another situation that happened in Zambia, there was an increase in turn of 6% of the cost of all the period of 2021, 2022. This was all done with Flame and other members of our advocacy in Zambia. So concluding, when we start the communication for the SBC, the religious leaders, they show the credibility within society, and they are very serious about malaria, because this is a program, this is a public health program, and they are open to hear from the population all the barriers that the population are facing. With the knowledge that had acquired, the communication, all this SBC, they do the advocacy with more credibility, with all the trust they have already established with the community, which allows them that our fight against malaria to be efficient and efficacious. So that to say, the religious leaderships is very strong as nationally trying to influence a social behavior against the fight against malaria. Thank you so much for your attention.
Wow. That is such an exciting presentation. Thank you so much. So our first presentation, we heard about faith leaders as messengers of malaria messages. And in this presentation, we've heard about faith leaders as advocates for removing barriers, which I find very exciting as well. Those were some excellent examples that we heard from Angola. Thank you so much. I'm curious, and anyone else who has questions, please type them in the chat. I'm curious, you talk about some folks, some faith leaders on the other side of the border, the Zambia counterparts. How did that collaboration look? How do you do cross-border collaboration on this issue?
Na implementação do FLEM, nós temos algum
When
movimento.
we were implementing FLAME, we have to achieve this advocacy and behavior change. So FLAME uses a national approach where we integrate all members. So we are talking about an international conference when we are showing everybody, especially faith leaders. This happens with different countries. When this happens, we establish some kind of exchange, which means the coordination from one country goes to the another one to learn the best practices, because the results depends on the reality, the context of each country, right? So we have to work together, because despite the fact that we have borders, we know that the insect doesn't respect borders. So we need to use those efficacious results. And that's a way that we do it, to work with the faith leaders in different countries. Thank you so much.
Very, very, very interesting. Another question I have, I'm wondering if some of these faith leaders have been pulled into other health issues as well. Now they've, become strong malaria advocates. Does the health system see them as advocates for health in general, or just malaria?
Bom, o FLEM é uma
Well,
coalizão.
FLAME, it's a faith leader coalition for malaria, but we are open to work in other diseases. I'm going to share an experience that we had in Angola. Due to the visibility of our faith leaders, they are already now talking about sexuality, talked about vaccination in church, but because the main cause in Angola, Zambia, in Namibia as well, it is in the elimination phase, malaria is the main point for us. Although we are linked to the national forum, and Zambia has a very specific activity, but we are open about to work other issues. But FLAME's focus is malaria, and to do all the mobilization for malaria elimination.
Sure, that makes a lot of sense. I can just imagine in the community context, once somebody becomes a malaria advocate, they become, an advocate for all health issues as well. So I can imagine that's probably happened. So thank you so much, Jaulino Rafael. We really enjoyed your presentation. We need to move on to the next presentation. We have Cynthia Obi, and you'll help me with your name if I didn't get it right, but she's with USAID Zimbabwe Assistance Program in Malaria 2, ZAPM 2. The floor is yours, Cynthia. Let's hear about your lightning talk. Go ahead. Next slide, please.
Thank you, Anna. Greetings, colleagues. I'm Cynthia Ngube, SBC Specialist for ZAPM2, which is a USAID program, Zimbabwe Assistance Program in Malaria 2, which supports the National Malaria Control Program in malaria prevention and control. Allow me to showcase our success story on the Community Action Cycle CAC, where the community managed to utilize data to target malaria control interventions in Chidodo Clinic, Mbire District, which is Mashonaland Central in Zimbabwe. So Chidodo is a high malaria burden area, and this is despite the fact that there is high indoor residual spraying coverage. In 2019, special populations, and by special populations, I mean people sleeping outside due to high temperatures, stream bank cultivation, and guarding crops at night, were not adequately covered by IRS. In addition, behaviors like late booking for antenatal care, inadequate utilization of long-lasting insecticide-treated nets, and late malaria treatment seeking were identified and needed to be addressed. So to empower the community to explore, quantify their malaria burden, and develop tailor-made sustainable local solutions, ZAPM2 trained the Chidodo Health Center Committee, HCC, on the CAC in phases. The CAC is an effective community mobilization approach for developing positive, sustainable development and health outcomes, with solid evidence having been gathered across multiple sectors in 42 global programs in over 40 countries over the past decade. So the CAC empowers the community to prepare to mobilize, organize the community for action, to explore their own health issues and set priorities, plan together, act together, evaluate together, and prepare to scale up, as shown in the diagram on the bottom left. In terms of training, 4 one-day trainings were done, and after the training, the HCC went on to analyze local malaria data in terms of person, place, and time. The data showed that most malaria cases were from a neighboring district and some special populations which were along the Mozambican border. With this information, the HCC then worked with the community to target interventions based on data. ZAPM2 supported the efforts by providing nets, stationary and supportive supervision during the plan implementation. So looking at the results that were achieved, the HCC managed to carry out some activities at community level that were meant to address the identified behaviors and protect special populations against mosquito bites. These activities included community meetings, net hang-up campaigns, and demonstrations, as well as community dramas reaching 247 households. They also had dialogues with community leaders and intensified malaria health education. 669 mosquito nets were distributed, and community members actually developed their own local lens policy to hold each other accountable to curb net misuse. After that, treatment seeking improved, and the special populations are now using lanes outdoors. The top right picture shows a community health worker giving out a mosquito net, and the other picture shows a malaria meeting at community level. So in terms of the lessons learned, we learned that the CAC process actually capacitates the community with skills to utilize malaria data for collective action, and that community engagement leads to community empowerment and sustainable collective action. I'm happy to say that this is a sustainable approach, as the community action groups in Chidodo are still active, and the community leaders in the area still monitor their malaria cases through their community health workers and health facility staff independent of initial ZAPIM2 support. The community also learned through CAC that data utilization is key in targeting malaria control interventions. This is evidenced by a quote from a Chiloro-based community health worker when she said, "Whoever thought that just the use of data will help us reduce malaria in our village. Surely data can open closed doors." The CAC is currently being scaled up in 13 districts, and hopefully we'll get another chance in the future to share achievements. Thank you everyone for your attention, and thank you, Anna.
Thank you, Cynthia. Fantastic. Wow, what a really cool approach, and what great results you have to share with us. Tope has a question that I actually also had. Thank you for the presentation. Can you please describe some of the policies put in place by the communities to curb misuse of ITNs, and how are they enforced?
Thank you for the question. So I wouldn't say it was many policies. It was actually one policy where community members sat down and agreed that in case there is someone in our community who is misusing nets, we will hold them accountable and we'll talk to them and discuss with them that it is not how they're supposed to use the net, because we need to discuss it within ourselves and make sure that nobody misuses the nets within our community.
And do you know if they ended up having to have those conversations?
Definitely, they did, because such behavior is very rampant in communities. But I'm happy to say that ever since the community action group started working in the area, such behaviors have gone down, which is something to celebrate.
Absolutely, that's fantastic. I have some more questions as well. So the quote about the data being such an important part of this is so interesting to me. Can you talk about how the data is presented to the community members?
Okay, so what happens? The health workers at facility level, they part of the health center committee, which is like the bridge between the health facility and the community. So they discuss the data with the community together with the community action group, and they clarify it as much as possible to make sure that the community understands at its level what we mean when we're talking about malaria cases. So the information is clarified, but at the end of the day, the community gets a clear picture of the number of malaria cases in the area, and then it's very important for them to understand it so that at the end of the day, they know how to act and target malaria control interventions.
Super, and I think we have time for just one more quick question, if you can answer it quickly. Augustine asked, how have the communities benefited from training or the capacity building?
Okay, so if you look at the composition of the community action group, it consists mostly of community leaders and community members as well. So I would say the community benefited a lot because the community action group members are now people who are available in this community, and they have these skills to identify that we actually have high malaria burden in this area, and they can pinpoint the malaria hotspots in their area and identify the drivers, the specific drivers, and work together with a specific community to come up with tailor-made local solutions. I think I would say they have benefited a lot, and especially because the approach is very sustainable, and it will continue in the long run.
Yeah, it's clear that this is a sustainable approach. Thank you so much.
Yeah.